Well, I've decided, yes, I may as well tell my story, because 4 years ago, when I was going through a terrible time, I looked to see was there any patient I could speak with, and nobody was able to tell me there was any patient. So I really felt alone, I'll be honest with you. I started off in 2007, and I got a very bad pain, and I was diagnosed with epithelial ovarian cancer, stage 3. Now, prior to the diagnosis, I'm really looking back now and realising I had a lot of symptoms for a long time, but didn't realise there were problems. I had been attending a gynaecologist because I was suffering from incontinence, and I was diagnosed with overactive bladder, and the treatment for that was medicine and physiotherapy. I did both, but nothing worked for me. I had physiotherapy for 8 months, and I felt at that stage time to give up. Wasn't doing me any good. It was getting worse. So I continued on. Then right after that, after Christmas 2006, I got 3 kidney infections back to back, and I had taken 3 rounds of antibiotics. I went to the doctor, and the day after I finished with the antibiotics, I started feeling the symptoms again. And I had intended to go back to the GP, but of course I hadn't gone back, and I got this terrible pain. I wasn't able to stand up, so I was sent to the hospital. And there I had a scan which showed I had large mass in both ovaries. From there I was sent for an MRI, which confirmed that there was a link between both ovaries with some fluid in the abdomen. I was scheduled the following day for hysterectomy, and when the gynaecologist came to speak to me, she told me that I would have the hysterectomy in the morning, but there was a likelihood I was going to lose my bowel as well. Now, it was a terrible thing to find out that you had cancer, but the thought of losing the bowel as well nearly killed me altogether. So I remember at the time saying to her, please save my bowel, whatever else you do. And it seems daft now, I was more worried about the bowel than I was of the cancer at that stage. So I had the operation, and when she came back to talk to me, she told me that there was no problem with the bowel and I was fine, and that the operation went exceedingly well, and she felt I had a good chance of very good recovery. So I recovered very well for the surgery, and I went home and spent the 5 weeks at home trying to get as fit as possible and do all the things I showed, eat properly and do everything well, with the hope that I'd be quite strong by the time I'd have the chemo and that everything would go well. I had chemotherapy then, 8 rounds of chemotherapy, and it was carboplatin and Taxol. Now I must say, okay, chemotherapy is tough, but I didn't find it that tough. There was days that was fairly kind of good, and days that I didn't feel as well. But I would say in the beginning, I only had about 3 days each session that I felt kind of, what I would say, fragile. And that was in the periods when I was having the anti-sickness and the steroids. But other than that, I didn't have much except maybe exhaustion every now and again. But you could live with the exhaustion. Then, we'll say, when I got to about stage 3, I started having numbness in my fingers and feet, and I was given vitamin B6 for that. Now, that worked a treat for me. I know it doesn't always work for everybody. So I got on with it and got through the chemotherapy, and we'll say the last few sessions I would have had maybe 5 or 6 days I felt fragile. But you still had 2 weeks to recover before you had the next session. So it was okay. And I lived and went out for coffee and met my friends and did everything as much as I could. And the days I didn't feel well, I rested and stayed at home. Then when I was finished chemotherapy, I was the sort of person that thought, you know, you could do everything in life. And I didn't believe in sitting around. So I thought I'd just get back to normal fairly fast. But I started to realise a few months down the road, I was feeling very exhausted when I did a little thing. And I thought, this doesn't seem right. But I kept going, and I was back to the oncologist later, and of course I probably asked too many questions, and he reminded me how serious my cancer was, and that the likelihood of reoccurrence was very high. And of course he gave me the percentages, and of course I turned around and said to him, sure, I'll be in the other percentage, the low ones that's not going to come back. And I genuinely meant it, and he actually said back to me, we'll see. And I thought that day he wasn't giving me any hope. He was trying to, you know, make sure I knew I might get it back. But I thought, I'll show him in my own mind. But 2 years later, unfortunately, I came back, and I had recovered fairly well at that stage, but I had decided to give up work because I just wasn't able for work anymore. And I thought maybe the strain, I was just kind of slightly afraid that it might come back. So I thought, yeah, I'll find other things to do. So I started living life with my new normal. But then suddenly 2 years later, I started to feel what I can only describe as a slight flutter on my left side. And it's only when I got that I realised I had that symptom for a long time before my initial diagnosis. And I'd never even mentioned it to the gynaecologist or the oncologist. So we'll say about a month later, I was back due for my normal 6 or 3 monthly checkup, and I told him, and then he said he'd do a scan. So we did the scan, and of course the scan actually wasn't done for another 3 months because he thought it didn't really matter whether I did it now or in 3 months' time. So I opted for the 3 months later, not to bother about it too much. And I did the scan 3 months later, and the scan came out saying no evidence of recurrence of disease. Now I was very happy walking out of there and said, oh, grand, might be fine. But then a few weeks later, I started getting these symptoms again of urinary tract infection. And I went to the doctor 3 times in all. Within, I say, probably I left 3 weeks between each session. And each time, nothing showed up. And then at that stage, I was beginning to get an odd pain with bowel movement. So I thought, yeah, I better tell her that at this time. So I told her, and she sent me for a colonoscopy. And again, that came out, no evidence of any disease. So again, I felt fine, but the pain at the stage was getting worse, and it continued that way. So I then asked to be sent to a gynaecologist I had seen in Dublin during my first round of cancer. And I went to him, and he was a specialist in cancer treatments. And I told him on the day that I had a lot of pain, and he did an internal examination. And he said to me that there was absolutely no evidence of cancer, but I maybe should go back to my own doctor again if I was having pain. And he said he thought, for what it was worth, that I looked really well, and that he didn't expect to see me looking so well after a year. So again, I went off feeling happy, but on the way home, the pain was very bad. So I thought, I'd nearly prefer if it was cancer at this stage. At least I'd know what I was doing. So about, I suppose, a month later, I went back to the GP again. And I asked her this time to repeat the CA125. And to my horror, the CA125 was up in the hundreds. And at that stage, I was rushed to the oncologist again. And I was now at a stage that I'd spent weeks sitting up in bed at night with maybe 4 pillows behind my back instead of the 1, because I could no longer lie down. And the night before I actually went to the oncologist, I had spent 2 nights sitting up in a chair because I couldn't lie down at all. And I didn't understand why I couldn't lie down, because there didn't seem to be anything wrong with me. But when I got there, they found that the CT scan was done at that stage, and the CT scan showed that there was a large amount of fluid in my abdomen, and my stomach was very extended as well. So I was sent to the regional hospital, and a drain was inserted, and 12 litres of fluid was taken from my abdomen over a period of 3 days. And then I was put forward for chemotherapy again, but this time I was going to have gemcitabine and Taxol. And I was to have 8 sections and 2 weekly, 8 by 2 we'll say. So I was having chemotherapy every 2 weeks, or 2 weeks on, 1 week off. I'm afraid chemo and I didn't get on too well on this time. I was sick on the first day. I was really ill the first day I left hospital. But, everybody thought it was because it was the amount of fluid that was taken from my abdomen. I was very, very weak. I recovered enough to be able to take the next round of chemotherapy, but by the second round, I was so weak at that stage, I ended up in hospital. I had a blood transfusion at that stage. I went from there with regular antibiotics. I was on antibiotics sometimes for a month at a time. I was hospitalized on numerous occasions with infection. I had weakness all the time. I was now at the stage, I was most of the time in bed, getting up maybe for about a half an hour at a time. I was even gone to the stage that my head was too heavy for my neck. I'd have to have something holding my head up while I was up. But I still struggled through, and by the 6th round, I became neutropenic and ended up in hospital again for about, I'd say, the 3rd, 4th time. So at this stage, I talked to my oncologist, Dr. Donlan, and I asked him, could I give up chemotherapy? And he said, look, we'll reduce it for this round and see how it goes. So we reduced it, and I went back and took that round. But again, the reduction made no difference to me. I felt no better than I did before. So at the end of that, I went back to see him again. And this time when he had done the CA125 again, originally my CA1 to 5 dropped immediately after my second round of chemotherapy, so it looked like it was doing a lot of good. But once we reduced the chemotherapy after round 7, the CA1 to 5 went fairly high again. So I had no choice that day. I went in with the intention of not taking any more chemotherapy, but I had no choice. I got scared and I just said, okay, whatever I have to take, I'll take it. And I remember him saying to me he was going to give me Calyx and that it had less side effects. So I kind of thought, yeah, maybe. And he was going to give it to me at 3-week intervals. So I thought, yeah, that could help me. And I remember him saying to me, there's no side effects, but you know, it could affect your heart, and I just have to tell you that. And I remember saying that, sure, doesn't matter now anyway. So I really did feel I was gone that far. So he said, I started off and started again to do the 8 cycles, but of course I didn't get through many of them. Each time I was sick, I was in hospital, all that sort of thing. So after I struggled to the 6 sessions, because I knew I probably did need to get 6. So after the 6th, I asked to see the oncologist again, and I said to him, no more, I'm getting out, because if I wait any longer, it might be too late. And he thought I was crazy at the time, but you know, then my husband, who was here with me today, long suffering, he decided to explain how bad I really had been for the last few months. And he said, in that case, I won't even give it to you. So I said, that's okay. So I was kind of scared then, you see, because I kind of liked the idea that there was 2 more rounds left if I needed them. So I actually asked him, would you give it to me later if I really need it? And he said, oh yeah, no problem, I'll give it to you later. So I went off, and first I took 2 weeks off. And, you know, I wasn't able to do much now. My husband did everything for me at that stage. So I decided, I'd read loads of books over the years about cancer and patients who had taken all the medical treatments they could take and were no longer able to take them. And still some of those were alive 15, 20 years later. And I wanted to see what they had done, because I always had that in the back of my mind, I'd look at other things. So the main things I noticed was that most of them did green juices, went on a vegan diet or a vegetarian diet. They took out all sugars and processed foods, no dairy, and took supplements and that sort of thing. So I thought, yeah, I can do that. Because at that stage, I felt I had absolutely no hope. If chemotherapy wasn't working for me, I was so weak, that didn't look like there was a way back. So I thought, yeah, this gives me some hope. And I remember at the time I did ring Cancer Care in Dublin, trying to see was there anything else I could do, but nobody was able to give me any help. And they said they could only talk to me about medical things, but I wasn't able to take anything in medicine at that stage. So I started in the regime and did my 3 juices a day, went on the vegan diet for the 2 weeks until I got back to Dr. Donlan. Now I must say it was tough, because I loved my meat and I loved food. And 2 weeks later I got back to Dr. Donlan, and I really did look a lot better. And he asked me what I did, and I told him, and he started laughing, you see. So then I said to him, what's my CA1 to 5 today? And he says, 11. And I couldn't believe it. It was lower than I'd ever had it. So I thought, my God, that's it, I'm out of here. And he said, I can give you the 2 more rounds now if you want it. And I said, no way. I said, I'll come back later if you give it to me, but not now. So then I went off for 3 months, and I came back after the 3 months, 6 months, 9 months, the whole lot, and I still remained well. Now I must admit, I changed the diet. I stayed on the green juices, and I went back to the normal diet like Maeve was talking about today. I didn't stay vegan, it was too tough, but I did leave out the sugars, and I did leave out the dairy, and I took plenty of supplements. And I took another supplement called Salvestrals, which was supposed to help as well. So I took that regularly. I took plenty of exercise, because I had this idea that maybe an hour of exercise in the fresh air every day might help as well. So I did that. I did acupuncture for the 2 years, and I did Reiki. And I even went to Cancer Care West, and I did a course on mindfulness, and I did bioenergy. I was going to cover all the angles, everything I read in the books. Some of them did this and some did that. So I decided I'll take the whole lot. So I stayed well, and I have been really well for the last, actually I've been well for three and a half years nearly now. I know at the time Dr. Donlan told me I would be on chemotherapy for the rest of my life, and that there was no remission from there. I was in remission the first time for 2 years. I'm now in remission 3 years. So, you know, I feel it's worked for me. Last year I got this feeling again on my left side, that kind of feeling like something picking at you. And I went to Dr. Donlan, and he did the scan, and this time they found a cyst. And again like that, he said, we'll check it again in 2 months' time and see what happens. So, of course, I went strictly back on my vegan diet this time. I wouldn't chance anything. And I went back 2 months later, and there was no evidence. The scan said no evidence of disease. So I took that and went off, didn't worry again. And then he redid another scan 6 months later, and again I got the same result. So then, unfortunately, I didn't think about it much after that, and I kind of got back to normal again. And then this June, he did another scan, and again there was evidence of a cyst. And he redid the scan 2 months later again, and then they found it was a lymph node, a swollen lymph node. So I asked at that stage, could I have it taken out rather than just assume it was cancer and see what it is. So I went to Dr. O'Leary, and I just had a biopsy there 3 weeks ago. And I meet Dr. O'Leary next week, and I'll decide from there what has to happen. I've had a relatively good life for the last 3 years. I'm hoping that whatever the future holds, I'll be able to deal with it. I don't know what I'll do, but I'm hoping there are new treatments if I have to have treatment. And I'm hoping the fact that my body got 3.5 years without chemotherapy, that I would be able to take chemotherapy again if I needed it. Whatever the outcome is, my view is I'll deal with it at the time. I won't worry about it now. Looking back over my journey, you know, over the 8 years, I'll be 8 years free in February. It was a tough journey at times, and there was some bad memories, but there were some good memories too. And particularly in the last 3 years, I did everything I could do for as long as I could. I travelled a good bit. I went to America a lot because I have a brother there. I went to Medjugorje twice, and I climbed all the mountains there, no problem. And I must say my faith kept me going at times. I am quite religious. When I had dark days and all I could do was sit in the bed, I spent a lot of time talking to God and praying. And I did feel it kept me going. And there was times, so many mass cards came in the door, I used to say, well, someone's prayers are going to have to work if mine can't. So it kind of gave me some hope when I really didn't have hope. I've had a lot of holidays with the family. I actually, would you believe, I did the Women's Mini Marathon every year since I had cancer, and I wouldn't dream of doing it beforehand. And the only year I missed was 2011 when I was too sick to do it. I climbed Cropatrick. I've done everything I can possibly do. I joined STSA last year. That's a cancer choir, and it's set up by Paul Donlan. And we have a branch here in Galway, and we meet every Wednesday night in the G Hotel. We sing for an hour, and then we have tea and coffee. I've made lots of friends through that as well. And if any of you want to join, you're quite welcome. Just turn up at the G Hotel, 7 o'clock on a Wednesday evening. I did lots of courses through Cancer Care West, and they were very helpful to me. I joined Cancer Care in Athenry, and they were extremely helpful to me during my illness. And I found it very good to be able to speak with other patients and people who had been through a lot like I had. I know, you know, when you get a diagnosis, you think it's the end of the world, but you know, there is life after cancer. You can do things, and you can do different things. You may not be able to do everything you were able to do previously, but you can do a lot. And there's always hope, and I'm hoping new treatments keep coming up. Thank you.